So I experienced a lot of ongoing chest pain after my SCAD event. Is this normal?
So recurrent chest pain after SCAD is very common and very normal. Up to about 90% of women who have experienced a SCAD event will go on to have episodes of recurrent chest pain, particularly over the course of the first 1 to 2 years. We don't really know what causes this recurrent chest pain, but there are a few theories or possibilities. These include pain that might be coming from the healing vessels or tissue. The pain can be caused by nerve pain, nerves that are embedded within the arterial wall that are trying to heal, or there can also be arterial spasm that goes on.
So it sounds like this is a fairly normal occurrence then.
Absolutely, absolutely. Fortunately, ongoing chest pain related to the SCAD event itself is pretty rare. Things like recurrent dissection or other complications from SCAD don't happen very commonly. And of course, there can also be non-cardiac chest pain, which is important to remember as well. And sometimes it can be really hard to differentiate what's cardiac chest pain and what's not.
So what other symptoms could I possibly experience as part of my recovery process?
It's really important to appreciate that after a SCAD event, both physical and emotional recovery needs to happen. In terms of physical recovery, patients with prior SCAD can, as we talked about, experience recurrent chest pain. So it's really important that they have the opportunity to review these symptoms at each visit with their treating physician. Patients might also have side effects from some of the medications that we use to prevent recurrence of SCAD or to treat other complications that may have unfortunately arisen from the SCAD event.
So how do I know if my dissection has healed? And can it happen again?
That's a great question. So physicians like myself use a lot of different tools to help tell us how a patient is doing after a SCAD event. So we, first and foremost, and most importantly, talk to patients. We inquire about symptoms, how you're feeling. We do physical exams to try to see how patients are recovering. We also tend to rely on a lot of tools, such as echocardiograms, cardiac MRIs, CT angiograms, and invasive angiograms that can show us how the artery is healing and how the rest of the heart is doing.